let's talk about this. So you go through the testing and you find, imbalances in certain organs and you find infections. And, in Susie's case, she had tons of different infections. Some were Lyme related, some were just other, different viruses that could be connected to other infections. So once you have that, and let's just say someone maybe has 30 different infections and several different imbalances, how do magnets work and how can they make it better?
Sure. So I think we've all played with magnets when we were younger. And when you bring one magnet close to another magnet, depending on whether it's north or south polarity on both magnets, you will either push the other magnet away if you're using two identical polarities towards one another. So north, north or south, south, you end up pushing that energy away. Or if you use north to south magnets, it's going to pull the other magnet towards, it's going to attract. So, depending on which way you're placing the magnets on the body, you're going to either bring more circulation to an area so that it starts to heal faster, such as bruises or after surgeries, wherever scars are involved. You place the magnets over that tissue where there's inflammation, and it's going to resolve extremely quickly. We're talking about, no edema and little to no pain at all. And, depending on the exact placement of the magnets, if it's over the liver and you've had several drinks and you've got a buzz going, by placing the magnets in a particular direction over the liver, you're going to be flushing the liver and stimulating the detox process. So that buzz that you had going for about half an hour, it's now going to drain and disappear within 5 to 10 minutes. And so it's really quite amazing because all of a sudden you feel back to normal. And so, I've tested that in at least 30 plus individuals over the years, and it keeps, the same response. He keeps occurring over and over. Not only is it a pretty immediate buzzkill, but there's also no hangover the next day. And so that's just one instance of, magnets over a given organ or area. You could do the same thing with the lungs. You could do the same thing with the kidneys, the bladder for bladder infections and other issues. And it's just amazing.
And I've seen that we've done it with sinuses. If there's congestion or the sinuses are just clogged, and there's areas where you would put it over the sinuses and you literally feel everything just drain down.
Absolutely. Yes. Excellent example. Yes. You've felt it several times. Absolutely.
Now, what about with specific infections? Because, obviously infections could be all over the body or they could be in a specific area of the body. So, can you talk a little bit about how the magnets are placed for infections? Is it different for different people, or are they the same placement depending on the infection?
That's a slightly more complex answer, but those are great leading questions because the honest answer is all of the above. And so, what I mean by that is when I first started out with biomagnetism, I went to the seminar down in Ecuador for a week and was excited with all the information that I, wrote down. And so I came back to my medical office and I said, okay, I'm going to start to use magnets on people and see if it really works, if all this is true. And so the first patient, that I saw later in the week had a urinary tract infection. And so I scanned her through muscle testing and determined that she had E. coli because when I asked about her index fingers as well as her thymus gland, her legs shifted, giving me a yes through muscle testing. And so thymus gland, and when it balances out to liver, represents E. coli infection. But so does index finger on the right with index finger on the left when you place magnets there. And so what I did in that particular instance was, even though I detected that she had the imbalances of an E. coli infection causing the urinary tract infection, before placing the magnets, I told her, look, I've identified E. coli, but I would prefer for you to go down to the local lab 2 blocks away, leave a urine sample for testing and culturing, and then come right back and I will place the magnets on you. But I told her, I suspect you have an E. coli infection. So she went there, she left the urine sample, came back, and I proceeded to place the magnets on those two particular pairs of points, thymus with liver and right index finger, black magnet on the right index finger, the fingerprint region, and a left magnet on the left fingerprint region, the index finger, and waited 15 minutes. And then I had her come back 3 days later and for her to pick up her laboratory results. When she brought me the results, it tested positive for E. coli infection. And when I asked her, how did you feel with regards to your urinary tract infection symptoms after I placed the magnet? She said, Doc, I'll be honest, after I left your office, after having placed the magnets, my fever, chills, urinary issues, symptoms absolutely disappeared. I feel fine now. And so to get that positive confirmation in the urine culture that, yes, she was very positive for E. coli, and that's what I had muscle tested out to, that was amazing. Even though she was symptom free, I said, you know what? Go back to the lab, drop off another urine sample, and let's see if you're still testing positive or maybe, somewhat positive, and I may need to write a script for antibiotics for you. And she said, okay, great. She went back down to the lab. She left another urine sample. She came back 3 days later, brought me that new lab report, and it came back absolutely normal and negative for E. coli infection. And so I thought, wow, this was a great and tremendous example of being able to treat urinary tract infections without the use of antibiotics, only through muscle testing. And I was able to confirm through laboratory testing that the bacteria were no longer present. Why? Because I balanced out the specific areas of the body where the E. coli bacteria was kind of hiding out or resonating with in the body. And so after that experience, I said, all right, I need to see if this was a fluke and let me test it out in other urinary tract infection patients, as well as pneumonia patients, as well as other patients. And so I started asking patients, go down to the lab, drop off sample, this, that. And let me tell you, after about 10, 12 patients doing exactly the same thing for urinary tract infections, and then other patients with pneumonias and kidney stones and this and that, it was amazing because if the urinary tract infection, I detected it was through protease bacteria or Klebsiella bacteria or Citrobacter, no matter what the bacterial infection that I detected, the laboratory would come back with that same bacterial infection. And then afterwards, the second lab would come back negative all the time. I did not recommend any antibiotics. So it was just absolutely amazing. And after, 12 or so trials of that, I decided, you know what? I'm no longer going to waste the patient's time, money, effort to drop off samples. I'm just going to simply treat with magnets. And if their symptoms don't go away, then I'll offer them a second or even third session. And so that's exactly what happened. I mean, it was rare that it wouldn't be resolved in one session, maximum 2 sessions. And so I kind of started getting confident after a while.
Yeah, well, that's fascinating.
It blew my mind.
And I know that since, you were actually in South America, right, doing research with malaria, and you were able to do stuff with magnets for that too.
Yes. So back then, I was also working with malaria, but I wasn't as confident. And so actually, last year, I went to Africa with a mission organization and I did my own research with malaria patients out there. And so I was able to prove that through the use of magnets, the individuals that at first were positive on the microscopic blood smear showing the malaria parasites underneath the microscope. And they were also positive for a blood test, what's called a rapid antigen blood test for malaria. After 72 hours, they were no longer positive for both the blood smear nor the rapid antigen or protein test in the blood. And so, exactly How that worked, I have no idea, but it worked. And so, unfortunately, um, we went towards the end of mosquito season and we were only able to test six total individuals. But of those six, they all became negative after one or two sessions of placing the magnets. And so we would like to either go back next year or at some point and repeat the experiments with larger numbers of individuals and prove this beyond a doubt. But I think 6 out of 6 is a great start.
Absolutely. And, speaking of malaria, I know that a lot of people may think, okay, well, malaria is something that I get, in Africa or in other countries, and it causes, these major symptoms and there's fevers and, it's very, very dangerous.